Hello, everyone, and welcome to the Interstate Compact for Respiratory Therapists Compact Kickoff meeting. My name is Grant Minix. I'm with the Council of State Governments, and we're very glad to have you all here today. A couple notes. This meeting is being recorded. A recorded version of this meeting will be available after the end of today's presentation. And there is a question and answer segment at the end of this presentation. You'll see in your Zoom toolbar a Q&A button to where you can submit your questions. And we may not be able to get to all the questions today, but we will get to whatever we can and have questions for our panelists as you all have questions and see things as they come available. Last little note for everyone, I think an important note for this group is Happy National Respiratory Care Week. We're very glad to have this compact kickoff meeting coincide with this and all the work our great partners at AARC are doing this week. So go ahead and kick us off. I'll be joined today by my colleague Carl Sims, Deputy Program Director here at the National Center for Interstate Compacts within the Council of State Governments, to assist me today in the presentation. Carl, I'll kick it over to you for a quick introduction.
All right. Well, hello, everybody. Thank you so much for joining us on this kickoff meeting. We're really excited to begin the work for an interstate compact for respiratory therapy. We first wanted to introduce ourselves a little bit at CSG, explain who we are and how we're involved in the work with interstate compacts, in particular licensure compacts. So give you a brief overview of our operations. CSG is a nonprofit membership organization that serves the three branches of state government. So we provide assistance to state governments by providing policy expertise, conducting policy research, meeting state members so they are better aware of the policy best practices that are out there. They can learn from other states. And included in our work is the assistance on interstate compacts. We'll go to the next slide here. So both Grant and I work within our National Center for Interstate Compacts within the Council of State Governments, which is a technical assistance center that helps states with the consideration of interstate compacts, helps them with the administration of them once they're up and running. So we're there to help provide a technical expertise throughout whatever the policy area interstate compacts might be addressing. We'll have a portion of the presentation talk more about what exactly are interstate compacts and how are they used, and particularly within the licensure landscape here. But we'll save that for later on, but just want to make sure that we were properly introduced and knowing that we'll be a long-term partner for this project. So with that, I'll turn it back over to Grant for our next set of speakers.
Thank you, Carl, and thanks for that introduction. This work to develop an interstate compact for respiratory therapists would not be at all possible without our fantastic partnership with the United States Department of Defense. I'm going to turn it over now to Mrs. Patricia Barron and Tammy Perot to discuss the impetus and importance of this project and the cooperative agreement we have with them.
Sorry about that, everybody. I couldn't find the right buttons. Hello, everybody. My name is Patty Barron, and I am the Deputy Assistant Secretary of Defense for Military, Community, and Family Policy. I cannot tell you how excited I am to be here with you today. All of our compacts are extremely important, but the respiratory therapy one is one that I'm very, very attached to because I also come from the medical world. I am a military spouse and followed my soldier around for 30 years. But I graduated with a Bachelor of Science in Nursing before I married my husband. And we traveled around and moved 14 times in 30 years, which meant that every time I went to a new state, I had to get a new registered nurse license. And so I have 7 state licenses to my name, and I can probably activate them at any time, but it would probably mean that I have to go back to school and learn how to be a nurse again, because you really don't want me to be your nurse. Trust me, it's been a long time. However, I do remember and appreciate how difficult it was to move around and kind of get resettled and relicensed in every state that I visited or I lived in. Our military spouses are so well educated, so well experienced, but they also have the same challenges. I think it's over 30% of them, and Tammy can correct me if I'm wrong, that own some type of a license. And so when you move around as much as we all do, you know, having to start all over again can be costly and timely, and both financially and with lost experience. You don't get to climb the ladder of a career the way that you had thought or envisioned when you first, you know, started off as a young graduate. And so the interstate compacts are so critical and so important, and they provide that opportunity to our military spouses, but to any respiratory therapist, you know, throughout the country, to be able to travel into a state that does acknowledge the compact, and therefore you could start working, and you could start, you know, creating the connections that you need to make in order to continue with your career. I would say that in today's world, where we seem to really have a shortage of medical professionals, this becomes even more important. You know, being able to be a bit more flexible with the certifications and licensing opportunities is very, very important. And I cannot thank you enough for all the work that you're all going to be doing very, very soon. It's not easy work, but it's so rewarding. And the compacts that we already have out there in the field are really being embraced and taken up by many states. And I know that it's not going to be any different for the respiratory therapy compact. And so thank you again for letting me be here, for telling you how much we appreciate you. And I will turn it over to Tammy Peralt now, who will explain a little bit more about what we're trying to do.
Well, ma'am, Mrs. Barron, thank you so much for those kind words and kicking us off on the right note. It is an honor to have you join us today to talk about the importance of compacts, not just for you personally as a military spouse. I am also a military spouse, but for those over 30%, our data shows between 34 to 36% of our military spouses that are in licensed professions like respiratory therapy. My name is Tammy Perot, and I am part of the Defense State Liaison Office, which oversees the work on the cooperative agreement and our partnership with the Council of State Governments. And this is enduring and long-term work that the Department of Defense is committed to ensuring that we succeed at by partnering with CSG on the cooperative agreement and developing compacts. The Defense State Liaison Office specifically helps work with state legislators. And when the compacts become available, we're out there talking about how compacts can support our military spouses in the states to our state legislatures. This is part of the Department of Defense's effort to identify and address the most pressing needs of our military families. And we believe occupational licensure is directly tied to the challenges our military spouses face with unemployment. One of the considerably high unemployment rate that military spouses face is a challenge for us and a readiness issue. And we are determined to get after it in every way we can. And compacts are one of those ways. On the next slide, you'll see where the regional liaisons are at out in the nation. So the Defense State Liaison Office has 8 regional liaisons across the nation. I'm coming to you from the Pacific Northwest, and we are available to provide support and information as the Respiratory Therapy Compact is finalized and presented to the states. This may be months to years down the road, but we're here to stand by this effort and support it through every step of the process. And the final slide is information on how you can reach out and work with us as you're going through this process, and that we stand by ready to support this effort. I am available at any time, and I look forward to the success of the work on the Respiratory Therapist Compact.
Thank you for that, Tammy and Mrs. Barron. We appreciate you all being on here today and all the great work you all do to help promote to support military spouses and military members and their families. This work would not be possible without you all. But to kind of shift gears a bit and talk about the profession's perspective on licensure portability and interstate compacts, the importance of this compact specifically for the profession. We're glad to be joined by two individuals who helped to get the gears turning to our work on this process, and I'll turn it over now to Carl Hinkson and Ron Pacewell.
Thanks, Grant. So I'd like to thank the Department of Defense for this opportunity to pursue compact licensure. I think this is a fabulous opportunity for collaboration, and we couldn't be happier at the association. So the AARC will work with the Council of State Governments to create, or we're going to propose individuals who will create a technical assistance group or a TAG group, which will be convened underneath the Council of State Governments. I'd like to thank the Council of State Governments for, they're going to be coming to Congress this year in Nashville in a couple of weeks. They're going to meet with the board of directors, and they're going to provide a presentation to our House of Delegates. And again, thank you very much. That would be very helpful for making everyone understand the process as we pursue this. Compact licensure, although important with the profession, it is going to require a strong partnership with the AARC and our state affiliates as we work through the legislative changes that have come along with compact licensure. We look forward to that work, but as you may have heard previously, there's going to be a lot of work coming down the pipe. So this is important work. This is going to help us have our military spouses be more mobile, and it will help improve patient access now. And hand it over to Ron.
Perfect. Excellent. Thanks, Carl. I mean, I'll echo some of the comments from Carl. I mean, we are extremely appreciative of the Department of Defense and the Council of State Governments for assisting and augmenting this process. And also, I think a special thanks to the Department of Defense for the foresight for understanding the ability to have a mobile workforce. I think we talk a lot about the workforce of our military veterans and spouses and such being moved across the country, but we look at this from a mobility standpoint of having respiratory therapists able to move around for various unforeseen circumstances across the country. I think we've seen it in the past with different natural disasters where it's important to move healthcare practitioners to areas where there's high demand and high surge. And I think we all remember exactly what happened in 2020 when we had a respiratory pandemic on our hands, and we needed to move healthcare workers around the country for various surges associated with the COVID-19 pandemic. There's other things as well. I give an example. As I've traveled the country, we've had a hospital in the East Coast, and some of those states are pretty close together. And one hospital system had a level 2 NICU on one side of the river and a level 3 NICU on the other side of the river. But those are two different states connected by a 500-foot bridge. And so in order for them to go and jump in an ambulance and go across the bridge to pick up a baby on a ventilator to move into higher level care, that respiratory therapist that has high levels of regulatory and licensure, et cetera, had to have multiple licenses just to go pick up that baby on the other side of the bridge. So it kind of shows that the mobility of the respiratory therapist is really important, but also it shows that there's a high regulatory demand for this licensure, which may impact not only the respiratory therapist, but the director that's staffing. But most importantly, I think the one that we can't overlook is the patient. So being able to move our respiratory therapists around to meet the demands of the patients are the most important thing. So I would just like to give huge thanks to many people here. And I wrote everybody down because I like to quote one of my favorite comedians, and it's Chris Rock, and I'll keep it nice and clean, obviously. But he said that, a group of people can move a couch really easy and one person can't move it at all. And I think when you're a committee chair or a quarterback, you get a lot of credit when things go right, and you get a lot of criticism when things don't go right. But really the work and all the credit goes to the people that helped bring this together. So Carl, for entrusting me as the chair of this committee, the unbelievable work from the ARC to do this, which is, Doug Lair, obviously Miriam O'Day, Dan Garrett, I have Ellen Wollersheim, Manny DeVries, and Crystal Layton, and to help to keep all this together. But really, it's to thank the volunteer respiratory therapists that helped to work on this committee and task force over the last year. And I'm going to name them all quick. I'll go really quick. Steve Zakowski, Lexi Caraway, Terry Miller, Maria Madden, Robert Johnson, Natalie Napolitano, Megan Coster, Lee Wisdom, Kyle Hitchens, Kyle Durgan, Glenn Milano, Ed Goodwin, Benga Egabel Mousy, Aaron Light, Andy Schwartz, Ryan Sharkey, Wayne Walls, and Mike Madison, Steve Smith, Chris Slocum, in concert with special guest Bill Cross. If it's not for these people volunteering their time and giving their expertise, these things aren't possible to do. So thank you ever so much for everybody for assisting this, and we really look forward to the future of compact licensing. So thank you.
Thank you, Carl and Ron, for that great bit of information on the work that's been done already. You all have really done a great job in laying the groundwork so we can get this project started and get a compact going for respiratory therapists. And thank you also for that perspective on the importance of this work. So now we're going to transition more into the meat and potatoes of this presentation and what the answer the question, hopefully, a lot of people are out there asking, and that is, what is an interstate compact and what is it going to do for us in the profession? And to kick us off on our Interstate Compacts 101, I'm going to turn it back over to Carl Sims.
All right, thanks, Grant. So to start off with, what is an interstate compact? We'll see our definition up there. Quite simply, a legal, legislatively enacted agreement between two or more states. So you can think of it as a legal contract binding two or more states to a certain provision of agreements on a policy area. Interstate compacts require at least two states for them to form, but there's a number of examples of compacts being 50 state members, and then also including the territories as well. So a good example to think of to illustrate interstate compact is a driver's license. So your ability to use your driver's license and operate your vehicle on the roadways of other states that you're not licensed in is thanks to interstate compact. So states are mutually recognizing that license and your ability and competency to drive on those roadways. So states use interstate compacts to solve a number of problems, really looking to collectively use their resources together, respond to national priorities with one voice. So it's a way for states to realize that there are different policies that are out there between them, but they share those some certain problems that they can better address through interstate compacts as a policy tool. Go to the next slide. And looking at interstate compacts a little bit more broadly here, CSG is in the process of redeveloping its database to catalog the number and type of interstate compacts that states are already a member to. And so looking at some of those preliminary numbers here that we've identified, over 275 interstate compacts across the states, and each state's member between 20 and 80 of those interstate compacts, with 46 on average. So just because your state may be a member of currently only a few interstate compacts for licensure doesn't mean that they're not a member of interstate compacts for other policy areas. So we'll see an example of a few of those interstate compacts listed here that details the different policy uses of them. So everything from higher education to emergency management, transportation, and natural resource management being among the uses of interstate compacts. In total, about 2,500 total compact enactments exist across the country. Next slide, please. So for occupational licensing interstate compacts, states have been increasingly turning to interstate compacts as a way to solve a number of issues that are a result of each state having its own licensure policies. So they're there to help facilitate multi-state practice and also maintain and even improve public health and safety with increased coordination on licensure portability and certain things that the interstate compacts typically provide, such as a data system to share information on disciplinary actions and licensee information. They're also there to help preserve states' existing authority over professional licensing, so a way to complement what they already exist in regulation by just reducing the barriers that were the unintended effect of those different policies across states. So you see here the statistics that we have for licensure compacts. There are 17 compacts that currently exist for occupational licensing. Typically, these exist for one profession or multiple closely related professions, and that's because interstate compacts are formed to the unique needs of a profession. So it's there to reflect how states currently regulate them, and then maybe what those particular needs are and how the profession is mobile already across states and what the intended use of the portability is. So, for example, telemedicine being a primary concern for states to make sure that they can increase access to those services. So you also see here across the different compacts, 290 pieces of licensing legislation for compacts have been passed since January 2016, and that 50 states and territories have adopted at least one compact, and 41 states and territories have adopted at least 3 compacts. Next slide, please. So looking at the benefits of licensure compacts, particularly to how they benefit the licensed practitioner. So they're there to obviously reduce the barriers to licensure portability, and in doing so, licensure compacts provide a streamlined way for a practitioner to be able to apply for multi-state practice. It's there to reduce the barriers that also exist, maybe from fees that we see from licensure compacts that are up and running, there to make it more cost-effective for them to have that authorization to practice in multiple states, and also reducing the time it takes for them to receive that authorization as well. Licensure compacts are there to leverage advanced technology, as I mentioned, telepractice being a primary way for states to increasingly use technology to increase healthcare access, and then supporting military members and their families, knowing, of course, that they may have to relocate across state lines more frequently than your typical practitioner. So it's a way to help reduce barriers, particularly for that population. Next slide, please. So benefits for licensing boards as well. So through the Interstate Compact, and because it's a legal contract among states, it provides an agreement on uniform licensure requirements. So that's part of the way that there's those reduced barriers for someone to be able to apply for multi-state practice, because states are agreeing to those standards at the forefront through legislation. Interstate compacts for licensure also commonly create a data system. Again, that helps facilitate that ability for someone to apply for multi-state practice. It's also there to help strengthen public health and safety by allowing states to more easily share disciplinary action information with our fellow compact member states, as well as investigative information as well. It's also really important to note that through licensure compacts, states retain control of the scope of practice that exists within their current regulations, as well as that initial licensure process. Licensure compacts are voluntary, so knowing that not everyone will need or want to practice in multiple states is an additional pathway for those who do have that need to be able to do so in a way that is better facilitated. Next slide, please. And then looking at those overall benefits to states from a policy perspective. So licensure compacts are there to help strengthen state sovereignty. So where they already have the authority to license professions and occupations, it helps maintain that. Again, they're controlling the scope of practice still, and as well as the initial licensure process. So it's maintaining that authority while, again, reducing those barriers that otherwise exist because of those different policies that exist. It's there to enhance cooperation between states. So interstate compacts are run by a compact commission, and that's comprised of the compact member states and their delegates. So they're there to talk through the operations of the compact once it's up and running, and doing things such as rulemaking to ensure that the operations run smoothly and is responsive to the needs of the compact member states. Licensure compacts are there to also strengthen labor markets and expand healthcare access, being, of course, a key concern across states in finding those different levers that exist from a policy perspective to make sure that they are achieving those overall aims within the state. Next slide, please. Also wanted to quickly mention that, and going back to my comment about that, interstate compacts are constructed based on the needs of a profession and how they're currently regulated. So there's not one size that fits all for interstate compacts. It has to be responsive through a stakeholder process, which Grant will detail, which gets to the creation of the model language. So there's just an example of a few of the different models that exist across compacts. The mutual recognition model is the one that is the most used across those 17 licensure compacts. And a way to simply think about that is if you're in a compact member state and wish to practice in another compact member state, you're qualifying licensure, and if you otherwise meet all the qualifications of the compact, that's recognized by the other compact member state, either through an application process or a multi-state model whereby your license is used to purchase a multi-state authorization, and you're able to practice in every member state. So the details about how this interstate compact will work will obviously be determined in the months ahead. But again, just wanted to make mention of the variance that exists across compacts, and that through the important work of the project group, the technical assistance group, stakeholder review is paramount in making sure that those needs of the profession are responded to. Next slide, please.
Thank you for that, Carl. I'll take over from here and discuss a little more in depth some of the details you touched on earlier. And one of those being all of the different licensure compacts which have been enacted throughout the states. You see professions here which have licensure compacts that are being distributed out to states. A few of these are active in issuing licenses. Some of them are going through the phase and the transition phase to where they have enough enactments and are beginning to issue licenses. And then a few of them, which you can see towards the bottom, which haven't quite hit their threshold of enactment, but the majority of these are newer compacts. A lot of these are through the Department of Defense Cooperative Agreement, which I'll touch on a little bit more later. And many of those were just released within the last year. So a lot of headway being done here. You can also see quite a few professions in the healthcare industry. This is, makes this profession a perfect fit. I think if you could tell, some of the very successful compacts are in the healthcare industry, and with such an important focus there, we were confident that this respiratory therapy compact will be very successful, and with a great history of healthcare compacts. To show a bit of the other side of this data is the compact enactments per state. You can see here there's no real preference on red or blue states or East Coast, West Coast, Middle America. Licensure compacts have been popular throughout many states, with, I think we mentioned earlier, 50 states or territories passing at least one, and only a select few not to pass any, with many states passing upwards of 8, 9, 10, 11 compacts. So this has been very popular throughout numerous states throughout the country. As I mentioned earlier, we'll list here some of the occupational licensing compacts we've developed alongside the Department of Defense and our DoD cooperative agreement. All of these compacts have been released in the past year. You see the compacts are cosmetology, teaching, dentistry, social work, and massage therapy. All these compacts have gained traction over the past session and have been successful, and will go through and have went through the same process for development that we're going to work on here with respiratory therapy. A couple more compacts that are currently under development with through the Department of Defense agreement. We have at the very top, of course, we're all familiar with respiratory therapy and beginning this compact work, which we're very excited for. Also, dietitians and school psychologists have been underworked this past year, and they will be released early in 2024. So, and now we're going to move on into that the bit of that compact development process that we've talked about. We show 3 main phases of the compact development process. That first is the development of model language, which is used to be promoted by the professional organizations and those of you in the profession to work and get those enacted in states for that compact to be able to be working for that state, for a state to become a compact member state, and then begin issuing licenses. And then that licensing, by the time they can issue licenses, that comes after our transition and operation phase, once that enactment threshold of enough states have passed the compact, and the compact commission can begin working. I want to touch briefly here on the highlighted version, which is the highlighted section here, which is the phase development phase that we're currently in, and give you all a little bit of an idea of what's coming down the road within the next year. Our first step is developing a technical assistance group, which is composed of around 20 officials, stakeholders, and issue experts in the area of respiratory care. And they work to examine issues, current policies in the profession, best practices. And out of this group, we will develop a list of recommendations for what kind of aspects are going to be important to include in the compact in order to promote interstate practice. And we at the Council of State Governments and AARC will work hand in hand with this group to develop those recommendations and make sure that group is well informed. Those recommendations will ultimately go to a group of around 5 to 8 officials, stakeholders and issue experts, which we call the compact document team. This team will actually put pen to paper and start to flesh out the model language, which will be eventually be distributed out to states. They're going to take the recommendations from the technical assistance group and be able to craft that document and then work to help us circulate that out to states and stakeholder groups for comment. An important aspect of after the compact draft is developed is what I hope many of you can help us out with is in our stakeholder review session. This document that's originally developed by the document team will just be a draft version, and once we distribute it out to key stakeholders of the profession throughout the country to give us insight and feedback on that document, so we can ensure that we have the best document possible to send out to states and enact. And then that brings into phase 2, which is when we start to educate state policymakers in this area and hopefully begin to enact in states. A little more on what to expect here. What you all can expect is interested stakeholders in this compact. As I just mentioned, the opportunity to review and comment on that draft compact legislation. That is a crucial step in this process. We want to really build consensus on a strong document, and we know we can't do that without all of input from experts in the profession. We have a link here to our website, which will be hosted on compacts.csg.org, which will update as we move along in the process. Eventually, once a draft is developed, we will host that draft on to our website, and you all can check that out and be able to learn more on how you can submit feedback on that. And also a good note for this meeting, that document will be linked on there as well as the recording to this webinar. And then also supporting compact resources, frequently asked questions, guides on the policies, information on other compacts to give better context to what we're working on here. And then, as I mentioned, the recording of this webinar and then recording of our stakeholder review webinars as well. So that wraps up our informational session here, but we're going to move on to the question and answer session. We've had a little bit of some questions in our Q&A chat function. And thank you all for submitting those questions. So I'll submit those, ask them here to myself, Carl, and Carl Sims, and if anybody else on our panel wants to pitch in, they're more than welcome to do so. So I will go ahead and ask the first question we have submitted from Robert Boyd. Are there any steps that a state respiratory therapy licensing board could or should do now to prepare for participating in an interstate compact?
Grant, I can take a start at that question if you want to fill in anything further afterwards. I would say generally, the main part is going to come once the draft legislation is available. As Grant detailed, there'll be an exhaustive stakeholder review process. So really hearing the perspectives from the board and the states on that legislation, comments and questions, that'll be really useful to the technical assistance group and document team to make sure that they are addressing those any concerns or comments at that stage of things before it becomes available for state adoption. So there'll be opportunity for that comment and participation. And as far as, after the model legislation is out there, there will be in the model legislation a state requirements section. Again, that will be responsive to the what's heard from the stakeholder review sessions. That will be responsive to the work of the technical assistance group. But as far as the state requirements, the state must have those met before they're able to join. So depending on what those are, there could be some additional steps for the state to take. But largely those reflect how states currently regulate the profession already.
Thanks for that, Carl. I just add one little extra nugget is to make sure that people in your state, policymakers, those in the profession are aware of this work is going on, and to get them engaged in the process. The more people, once the compact model language is developed, that can get involved in this process, the stronger this effort will be. Thank you for that, Carl. Move on to the next question. What is the approximate timeline of the 3 phases of the compact development process?
Yeah, so to answer that one, for the first phase, we've generally seen it takes a little bit over a year from the kickoff meeting to when the model legislation might be finalized, again, comprising of the work of the technical assistance group, that stakeholder review process, but about a year it will take for that process that we've seen traditionally from the development of these other legislature compacts. And then through the education and enactment phase of that. So because these are legislatively enacted agreements, it is dependent on the legislative process there. But we generally see for a state to reach its activation threshold. So that's the prerequisite number of states that must join the compact in order for the compact to be activated and for the compact commission to begin its work on operationalizing the compact. That generally takes a couple of years, 2 to 3 years, to reach the activation phase. And the compact legislation itself will tell us how many states are needed to reach the activation threshold. Generally, though, it's about 7 or 10 states that the technical assistance group and then through the stakeholder review process that's chosen for that threshold. And then for the make the compact operational, that can generally take 2 or 3 years as well. The main component of that is the compact commission. Again, that's the government agency that's comprised of the compact member states and the delegates from those states. They're there to begin the operation of the compact by, adopting a budget, adopting bylaws, hiring staff, electing officers. But really the main component is developing the compact data system. So that will require the most resources and time before the compact can begin to its operations, and for a licensed professional who otherwise qualifies the compact to be able to use the compact for multi-state practice. So through the development of the data system, that'd be the largest chunk of time within the operation phase to get to across the finish line. But compacts are made there to have a long-term look of things. I mean, they're there. They have the government agency there. The policy is set through legislation. So while there is a longer timeline for them to get into the operation phase, they're built for the long run.
Good, Carl. Another question we had submitted, what are a few deliverables that would be expected from today's participants if we are interested in contributing?
I would just say for anyone who's interested in contributing, just to monitor the project websites. Again, we have that link on our slide, compact.csg.org. We'll be developing a project page specifically for respiratory therapy, and there you can monitor some of the progress of the compact project, including when the model legislation will be available for review. So I think that'll probably be the primary way for folks on this webinar to contribute to the process.
Is there an area of the country that you would think would prefer to pursue compact licensing as opposed to other areas of the country?
So we do know from the map that we had shown earlier, there are some states that have a higher number of compacts that they're currently participating in. That could be a number of reasons. It's really state specific about when a state might join a compact. Some of it has to do with the legislative process, for example, in states that may only meet every other year, obviously may have a longer timeline before they're able to join there. But looking at that map gives you a good idea of which states particularly have that higher adoption rate of compacts. and it provides a good indicator, I think, for other Western compacts, about who might be joining the compacts on the earlier side of things.
Thank you for that, Carl. It wraps up a lot of the questions we received. I want to have a couple notes. We have received a few questions. One, this presentation will be available on our website soon, within the next few weeks, and that will have a shareable link to where you could share with your colleagues and those you work with and other interested stakeholders who you want to spread the knowledge about this too. Another important note I want to make, that as far as the kind of the inner workings of the compact, the policies that will be in place within it, the requirements that Carl mentioned earlier, a lot of those we can't answer yet, because the working groups, the technical assistance group and the document team are going to work to develop those policies, and that work hasn't been completed yet. We're glad to have you all on here to present our process and the history of compacts, to give you all an idea of what to expect. But within more than likely next summer, we will have a compact document draft available for everyone who is interested in submitting feedback for that, and we'll be very glad to take questions and have conversations with licensing boards and professional organizations across the country on the policies that are in that compact, and have the opportunity to talk about the important requirements of the compact there. So thank you all for submitting your questions. Not seeing any more, I do believe, and a question, and just got one question to submit the website once again, and that is here on our last slide here at the bottom, with the contact information for myself and Carl. And make sure to check out our website once this webinar is posted, and to keep an eye out for it on compacts.csg.org. But ultimately, that wraps up our kickoff meeting for today, and we want to thank you all for joining us, and thank you all for your participation today. And we look forward to presenting you all with a compact document draft soon for your review, and look forward to your feedback and then efforts to help get the compact enacted in your state. So thank you all for your hard work and helping us with this process. And we thank you to our panelists as well for giving their insight. And have a great National Respiratory Care Week.
Great job, guys. Thanks so much.
Thank you. Excellent job, everybody. Thank you. Nice to meet you, Tammy.
Nice to meet you too, Ron. I just I put in the chat, I think you saw just the story you told about moving across a state line in that situation. I think that applies in so many locations, and I just think that those are the types of stories that will, quite honestly, really get to the heart of this work as we do it. The military spouse story, I always say, is just a sliver of this. So I think that is really important. All right. Thanks all. Take care.
Thank you.
Thank you all.
Bye.